Good day, Miss. My name is Monica L. Minorias from BSN2 Section F. And today I am going to show you on how to do the Leopold'S Maneuver. So before performing the procedure, it is always important to bear in mind that we should first wash our hands and provide patients privacy and identify your patient using the two identifiers like the name of the patient and the birth date of the patient. Then, explain the procedure to the patient for the patient's cooperation. Good day, ma'am. I am Monica L. Minorias, your student nurse for today. May I know your name and birth date, ma'am?
Yes, I am Maricel Melgar, and my birth date is October 8, 1983.
Okay. So, first, ma'am, we have to perform the fundal height measurement.
Okay.
So today, ma'am, we will be going to have fundal height measurement. Don't worry, ma'am, it will not hurt you as well as your baby, and it will take just a short period of time. Is it okay for you, ma'am?
Yes, it's okay.
So next is to instruct the client to relax and place it in a supine position, then expose the abdomen. So, I have my tape measure here. And the type of measurement that we will be having is centimeters. We will place it on the superior edge of the symphysis pubis up to the top of the fundus. So, the result is 35 centimeters, which means the mother is 35 weeks pregnant. So now we are going to proceed on the Leopold'S Maneuver together with monitoring the fetal heart rate. So when doing the Leopold'S Maneuver, we need to obtain client's OB history, determine the client's weight and vital sign, their LMP and AOG. And the equipments we need are the stethoscope and the Doppler with KY jelly if it is available. By the way, Leopold'S Maneuver is a systematic method of observation and palpation to determine the fetal position and presentation, lie, and attitude of the baby. This is important because they will help to determine of the position and presentation of the fetus, which in conjunction with a correct assessment of the maternal pelvis, that will indicate whether the delivery is going to be complicated or whether a cesarean section is necessary. So, as what I've mentioned earlier, we need to wash our hands, provide patients privacy, and identify your patient with the use of the two identifiers, like the name of the patient and the birth date of the patient. And explain the procedure to the patient for the patient's cooperation. So now, ma'am, I am going to perform the Leopold'S Maneuver, which means I am going to place my hands on your stomach to figure out the position of the baby. But before we start, do you want to go to the restroom, ma'am?
Yes.
Okay. Empty your bladder. So next, we will place the patient in a dorsal recumbent position to relax the abdominal muscles. And we're going to place a small pillow under the head to provide comfort. Drape the patient properly to provide patient's privacy and expose the abdomen. So we should warm our hands before placing them over the mother's abdomen to gain comfort. So for the first maneuver, is the fundal grip, which means we'll be determining if the baby's head or back. So in doing that maneuver, we will form our hands with triangle and we will be facing mom's face and place it on the top of the fundus. And feel if it is the baby's head or back. Baby's head feels hard, round, and big, while buttocks feels tiny and squishy. So for this part, I feel tiny and squishy, so which means it determines the baby's buttocks. So for the second maneuver is umbilical grip, in which we will be determining the baby's back. So in doing that procedure, we will place our hands on both sides and feel the baby's back.
Baby black.
One hand is supporting and vice versa. So the back of the baby feels firm and long. It is important to know where the baby's back because it is the most accurate for the measurement of the fetal heart rate. So now we will be measuring the fetal heart rate.
On the bed.
So the fetal heart rate of the baby is normal within limits. It's 160 beats per minute. So for the third maneuver is Pollock's grip, in which we were going to see if it's engaged. So if the head is down, it's the head engaged in the pelvis. We will make a letter L with our fingers and we were going to go down close to the symphysis pubis and we will going to see if we can lift the baby's head up.
A, B, C, D, E, Q. All day.
If we can't lift baby's head up, that means the baby is engaged. But if we can lift the baby's head up, then and we can move it around, then the baby is not engaged. So for the fourth and final step of the maneuver is the pelvic grip, in which we will be facing on the mom's feet and we will place our hands toward the symphysis pubis.
Toy. Ooh, toy. Toy.
It will determine the degree flexion of the baby, which means it will verify the position of the baby. Then after that, we will position the mother into its comfortable position and its original position. Okay, Mom? That's all and thank you for your cooperation.
You're welcome.
Okay.